So first, I'd like to introduce myself. I am Cory Parnell. I'm a principal at BGM, and we've serviced the cannabis industry actually since 2009. My partner, Jim Marty, took on his first client in uh, Longmont, Colorado, in 2009, and I joined that area of practice in 2014. And as my partner Jim Marty told me, this industry is full of hard lefts and hard rights. And at the time, I didn't understand what he was saying, but 10 years plus later, I definitely understand it. Very challenging, but exciting industry at the same time. And again, yeah, we've serviced over 600 license holders throughout the U.S. Since 2009. Today, I'm excited. We have Sasha Kalcheff-Korn, who's the executive director for Realm of Caring Foundation. We've worked with Realm of Caring for, I think it's 5+ years. They're a global education or research nonprofit that they seek to facilitate and encourage the mainstream acceptance of plant-powered therapies to benefit individuals as well as families and serve the healthcare providers, both in the hemp and the cannabis industry. So again, very excited to have you here today and cover the subject matter of how your organization works with within the industry of the cannabis. So welcome.
Thank you, Cory. Thank you for having me.
Yeah, and so just how cannabis market shifts how can they be predicted based on new scientific discoveries?
Yeah, that's a great question, and it's part of it goes back to the history of why Realm of Caring was formed in the first place by parents who are seeking solutions for their kids who were suffering. At the time, it was a lot of pediatric epilepsy clients, and I think that illustrates one of the greatest examples that we have of market shifts being predicted by scientific discoveries when we consider cannabidiol or CBD when it came to pediatric epilepsy. So Charlotte Figgie's story was aired on the Sanjay Gupta Weed One documentary on CNN, and that created a huge demand for CBD in the market, but also regulatory changes. And so Realm of Caring was founded around this time or just before this time. And we've seen firsthand over the last decade plus how new research, not just new research, but old research that was done prior to the war on drugs or during the war on drugs in Israel where it could be performed, where people were digging into what that research had said or what the new research is saying. And then that is driving their behavior and how they want to shop. So we have a free call center, a free hotline where anyone in the globe can call just to get some information on research. And we'll get people who call and say, I heard CBN might be good for sleep. Where can I find a CBN product? Or where can I find a THCV product because I heard it could be beneficial for weight management? And sometimes we've had people call and ask us for these minor cannabinoids that they've seen in research, but there's not a product available yet. And so it's really, showing how the consumers are paying attention to the research. They seem to be more just in tune more than ever with what research is taking place, and then their expectations of the market is that they should be able to find a product that matches what they've read about.
Yeah, a couple things you make me think of. One is when I mentioned back in 2014 when I first got involved in the industry. I met with Dr. Kyle Kingsley from Vireo here in Minnesota, and there were a lot of reservation on my partner's side about getting involved in the cannabis marijuana world. But when Dr. Kingsley introduced me to a mother with a 12-year-old daughter that had epilepsy, but by using the proper marijuana product or medicine, she went from seizures daily to maybe once a month, which was life-changing. And so that definitely that helps move the whole cause forward when people recognize the fact that there is a medical benefit to it as well, not just the adult recreational side. Um, so tell us some key research areas that are currently driving significant change in the cannabis consumer behavior that you're seeing right now.
Yeah, I think mostly, or especially those conditions that are treatment resistant. So considering autism, PTSD, migraine, fibromyalgia. We've seen historically that medications have been prescribed for these conditions that are known to be treatment resistant, and these various pharmaceuticals could exacerbate symptoms or cause new symptoms to take place. So these individuals are looking for a quality of life. And so we're seeing it emerge in research because there needs to be alternative therapies to these medications that are causing dependency issues or causing side effects. And so the medical community is in search, or the scientific community is in search of what alternatives are available. And when we think about treatment-resistant conditions, a lot of those conditions are correlated with an endocannabinoid deficiency in the body. So if we know that there's an endocannabinoid deficiency taking place, then that further prompts even more research looking at cannabinoids to replace those deficiencies. And so the consumers, then the research comes out, consumers are looking into that, and then they're even more empowered to be in search of these plant-based therapies or cannabinoid therapies that could help them naturally to achieve a better quality of life, free from the symptoms of these treatment-resistant conditions.
Yeah. And I forgot at the beginning, this is kind of a interactive webinar. So the listeners, I would encourage them, if you have any specific questions that you'd like to ask, please do that in the Q&A, and we'll either answer it at the time when you ask, or if we feel it'll be addressed a little later, we'll probably catch it a little later. Um, so um, and so who's leading the way on the research side?
Well, there's a lot of institutions that are leading the way, we've seen a lot happen in the States to catch up with UK registries and Canada registries that have taken place. And I think one of the cool things that we're really seeing is people who are paying attention to the observational data that's being collected in retrospective or prospective studies. We have ourselves been collecting data. We started a partnership with Johns Hopkins in 2015 to build an observational research registry because, as I said before, we have this free hotline, this free call center where we're accumulating all this anecdotal information and data on how people are using cannabis for a multitude of conditions and various products. And so we really wanted to capture how people are using everyday products, commercially available products in their lives and incorporating it into their lives. So not clinical by any means. And so I think that the attention towards these registries, the UK just wrapped up their observational registry. We have our current one. We're also working on one with Johns Hopkins for an NIH grant that was awarded to Hopkins 2 years ago. And there's just more attention being put there, which is great for research, because then we start to see the repeated conditions that people are turning to cannabis for. And then that can help us to inform clinical trials and, what's going to happen for insurance coverage potentially, or pharmaceutical routes for different cannabinoids. So, I mean, I would say there's a lot going on as far as, who's doing the best. I don't know. I think we're all kind of, but paying more attention to what the consumers are actually using cannabis for, which is the best thing that we can hope for in research.
Yeah, how do you see or how does it benefit or help the medical community um, become more pro um, I don't know, advisors for the cannabis medicine?
I think how it really helps is consumers are becoming more comfortable talking about their cannabis use given the legal status across various states. And so if they're comfortable talking about it and their doctor's becoming more aware, then their doctor's more, well, they're going to be using it anyway. So I might as well keep myself up to date on what are the benefits or what new articles are out there. A lot of the time when we're helping people, we're providing them resources then to take back to their medical team. So we're summarizing research, we're explaining how to find a quality product or where to find a product in the state that they're in. And then the mechanisms of action of the cannabinoids for their specific condition. So that way they feel more well equipped to go to their doctor and have these open and honest conversations, so they can potentially incorporate cannabinoids into their regimen. But I think it's starting with the consumer, honestly, because we know in medical schools that endocannabinoid system is still something that's not widely taught about, and it's up to the provider to inform themselves and take these extra courses to learn more. But yeah, the consumer is really driving that change.
Mhm. And how does the changes within the medical cannabis research, how does that impact the recreational market?
I think it impacts it because it's in a lot of ways, and because we saw, so when adult use first became legalized state to state, you would go to a dispensary and you would see a lot of high THC products. And now we're definitely seeing a shift when it comes to those products that are available. We're seeing a lot of different ratios of different cannabinoids. There's a big understanding that more people are looking to microdose. They don't want to feel intoxicated when they're taking a product, so they want to take low amounts that have ratios of other minor cannabinoids or have rich terpene blends in there because they want to elicit a specific response from their cannabis use. And when people are going to dispensaries, recreational, adult use, or medical, typically it's for a medical reason, or even if they haven't been diagnosed or given a medical card, they're still in search of that wellness portion of use. And so the recreational brands are definitely incorporating more of those blends into their products, but then also a lot of transparency and a lot of education, because when people come to the dispensary, we can't expect that all consumers are going to be totally informed on exactly what they need and how much they need to take. And so they really want to understand that their product that they're buying across the counter is safe. So they want to see a certificate of analysis. And they want to be educated on maybe the benefits. They pick up a product and it has CBG in it. Well, what's CBG good for? So they want that education to understand.
Yeah, and it's interesting how even my neighbor, who's in his late 60s, he had a hip replacement, but after he got recovery and so forth, he was struggling sleeping, so he tried some traditional over-the-counter, and then he eventually tried a gummy, uh, THC gummy, and then he figured out, oh, if I take 3/4 or half of this gummy, then I just sleep great at the night through the evening. So it's interesting that even that people will figure it out as more people talk to others and about how they're using it, not only just for recreational component, but and I know he was struggling on sleeping, so that was a great solution for him. So uh, I don't know if that's common in the marketplace or if they just word of mouth and then people kind of figure things out, or if the retail, the dispensary. I know our medical clients, they can help out because that's their mission. But even on the retail or adult side, I think there's movement in that. It's almost like a underground movement, I'll say.
It is, yeah, and I think it's safe to say underground because there is still a lot of stigma that surrounds it. Some of the comments that we see, even the research that we've collected and the qualitative data, is that people are saying, "I wish this was more acceptable so I could talk about my therapy or have more access to it or more education," because they still feel it's sort of it has to be underground. But a lot of a lot of calls that we get or emails that we get are referral based because they've heard about it from a friend or a family member, a Facebook group. And that again is one of the reasons why Realm of Caring started, was because the two moms who founded our organization were on these epilepsy Facebook groups, and other parents were asking, "Oh my gosh, what did you try?" And Realm of Caring had actually started as an organization to help fund families moving out to Colorado for access back in 2013, 14, 15. And then once it became more acceptable, or the Farm Bill passed, and then we had more medical laws passing state to state, that's when we opened our call center to just so people could just call in and get that information. But yeah, word of mouth is absolutely it.
What are, what are some tools or strategies that our cannabis operators can use to stay ahead of the emerging research trends?
Um, I think that one of there's a couple of big ones that come to mind. I would say, staying on the pulse of what research is out there and emerging. So if you're not already subscribed to a newsletter that produces cannabis research like PubMed, to become subscribed. For that project that we're working on behalf of NIH with Johns Hopkins, we have our website at cannabisandhealth.org. You can sign up for that newsletter because we are sourcing the top 10 to 12 research articles every month to deliver to people's inboxes. So they're getting that information delivered. And then I would say also just making sure that you're staying in tune with exactly what the consumer is asking for. And so whether that be finding ways to, directly talk and converse with the consumers who are using your product, or within the network of companies that you are aligned with who are using those products, or staying, tapped into an organization like Realm of Caring, who are talking to these individuals across the globe every single day. Um, and because we are hearing what people need firsthand. So just like a quick story on this, there's this well-known company who was making gummies. They were making CBD gummies, and a lot of them had botanical blends or supplements put in there. So there was melatonin in there was L-theanine, there was all these just different extra blends put into the gummies. And a lot of the parents who would call in, they were looking for a CBD gummy for their autistic kiddo because their kid didn't want to take a tincture because of taste aversions, and they couldn't swallow a capsule, but a gummy was easy for them to take, just a fruit snack, right? So they were looking for a botanical free gummy. And so we were able to take that feedback that we were receiving from people, provide it to the company, so then they could then make a botanical free CBD gummy with just full spectrum in there. So just, the consumers are going to tell you what they need and what they want. And in this industry, it's so unique because it is an industry where the consumer has outpaced every other industry that is within the cannabis market. Any science, medical, retailer, the consumer has been using cannabis for a millennia. And so if we're not tapped into their direct needs, then then we're not staying ahead of what they're going to ultimately be purchasing.
Interesting. Interesting. Do you have any practical advice on applying cannabis research findings to develop forward-thinking business strategies?
So I think for, like do you mean like staying in like the research space, like for the
Yeah.
operators? I think
Yeah.
with the conferences that come out, there's a lot of opportunity for businesses. A lot of the cannabis conferences are so focused on B2B, but I think if more of the businesses and operators went to these really research-rich public health conferences, you're going to find out information that's not being shared at these, well-established cannabis conferences that are focused on sales, or just focused on new product development. You want to go to these scientific, very rigorous conferences that are discussing, what new cannabinoids are being discovered and what are the use cases and what are the dosing regimens that people are following in the research to help further that development.
Interesting. I didn't realize that. So what's the most recent one that you've attended, and what was the biggest, I don't know, thing that you walked away from?
Yeah, so there's a few that happen in Denver every year. There's a public health one that's coming up in DC. I think the public health one in DC is always a good one. It spans over, I think, 5 days. And last time, I can't think of where it was last year at the top of my head, but so this would be public health centered, and so it's going to be discussing a lot of not just specifically cannabis, but because there is so much cannabis research emerging in the public health space, you're going to start seeing abstracts pop up where, researchers are coming to talk about what new science is available and the new innovative, findings from these different cannabinoids. So I would just kind of search for what public health or, just research focused, cannabis research focused conferences. ICR is another good one, Institute of Cannabis Research. So they are going to be in Portland in this year in October, I believe. That's always a great.
Portland, Maine or Portland, Oregon?
Portland, Oregon. Good question. Yeah, Portland, Oregon. So they're typically in Colorado. Last year they were in Fort Collins, but that comes out of Colorado State University, and so Colorado University. So they're also going to be a good one to follow for new research. And they put out grants and requests for proposals every year, so they're continually building upon that research that they have at their within their network.
We do have a question. One is, how do you advise medical or even recreational patients with the use of hemp source products when most don't have a COA or testing with them? How would you identify good product companies in the hemp space?
That's a great question. And one of the things that we do have is a product of quality matters guideline to follow. That's one of the things that we have hold a very high importance is when you're sourcing a company, ensuring that they do have a COA that has been verified by a third party lab. Ensuring that they have a customer support team and they offer things like a 30-day money back guarantee. Checking for the shipping and how quickly it's delivered to you. There's so many different elements involved in the quality of that product, because you want to ensure that if you're getting a tincture, it's not going to be the cannabinoids won't be degraded in shipping because it gets too hot or it's not sealed correctly. But then when it comes to the COA, what we are helping the consumer to do is to understand how to read it and understand why it's important to check for things like heavy metals and pesticides and residual solvents, and understanding that hemp is a remedial crop and it will absorb everything in the environment that it's grown in. And so if it's not grown in a safe, clean space and it's not tested, then you can't guarantee that you have a safe product. And that's another thing that we're just seeing state to state as far as, with legislation, is that state leaders want to ensure that quality hemp products are on the market. And so, you have these groups of these thought leaders to help construct what people have to follow, the standards that companies have to follow. But you're still going to see, that's highlights such a good point because it's still such an unregulated market. Even though there are state regulations, it's widely unregulated. And there are going to be a lot of these, quote unquote, bad players who are going to slip through the cracks that aren't being transparent about the product that they have.
Yeah, it's interesting here in Minnesota. A couple of years ago, there was a law modification, which I call it the gray area. So a lot of hemp product is made its way here, not through the adult program, but through the hemp legislation. From Colorado, California, I recognize a lot of the brands, but then again, there's a lot of brands I don't recognize that, whether it went through appropriate testing or not, don't know.
Mhm.
So that landscape just needs to continue to figure itself out and continue to have regulation. And that's one thing is, I would say all the clients that we work with, they do want enforcement and regulation. They want a safe environment, safe product for their customers, their clientele that they're working with. And I think that's just so important that people understand that people get into this business. They want that enforcement. They want the black market to be shut down. The operators that are not being, I don't know, safe, just trying to make a quick buck.
Mm-hmm.
Um, to have those bad actors shut down.
Mm-hmm.
Um, so in trying to think of, I lost my question, but it was, I think, really around if there's a big overlying message that you would want to share about the research um, to the listeners, what would that be? How can they help your organization? How can they help the consumers?
I think one of the big ways they can help, because it's great to be aware of what research is out there, but I think it's even better when you can encourage people to get involved in research, involved in these observational studies, because it's exactly back to what we talked about, like the word of mouth. Like if your friend tells another friend that this helped them sleep, then that's going to help that other friend, find a solution. And it's the same thing. And so with research, you have people who are afraid to tell their story because of the stigma that's still attached to it. But you have these research outlets where they can share how a product helped them or share an adverse event that happened from a product that they took through these different observational studies. We right now have 4 active studies or 3 active studies where people can take part in sharing their story in an observational way, not clinical. And those are going to be the things that really drive everything forward, drive policy forward, regulation standards, uh, entrance into the medical space, changing things in medical schools, developing new products that are helping people for specific conditions. It all starts with just this boots on the ground, tell your story into in a research registry that is IRB approved, that will be published in peer-reviewed journals. And so I think that would be the main thing I would say is, just encourage the people for the operators in the space, encourage people who are in your business or aligned with it to take part in these research opportunities, because it's gonna drive the whole market forward.
Yeah, how do they how do they participate in the research? I
Yeah.
mean, if I wanted to, how would I do that?
So we have on our website, we have the research studies that people can take part on. So we have our observational research registry that's been open since 2015. That is for anybody in the world with internet access to join. Whether or not you are a cannabis user, you can join it. So that way, of course, non-cannabis users serve as a control for that study. And there are 4 subsequent surveys that take place over the course of, or I guess it's actually every 3 months for 2 years. So it's 8 surveys that take place where people can just report on their use over time. We also have a female veteran study. One reason we wanted to focus on females is because we did a survey of 86 studies involving veterans, and only one was specifically focused on females. And we know that a lot of changes need to take place in the VA as far as what doctors are allowed to talk to veterans about if they want to safely consume. The VA doctors need to be informed. So we want to help with that policy too. We also have this study that we're doing with Johns Hopkins, which is basically a leveled up version of our observational research registry. So this study would be for people who are not currently using cannabis, but they plan to initiate cannabis use. And so they take 4 surveys over the course of the year. Again, another longitudinal retrospective study to understand the health outcomes of cannabis use over time, and then reporting whatever product that they're using. And then lastly, we do have a long-term CBD study for people who have been using CBD for the last 2 or more years consistently. I think for people who have found quality CBD products, they understand that it is safe and efficacious. but we don't have that really documented anywhere for long-term use to ensure that it can, be non-toxic, it can be safe for people to use for a long time. So we have that one as well. So we have those research studies, but then if you go to university websites, they will also list different studies that you can be involved with. A lot of those will be clinical trials that they're trying to recruit for. But yes, there's a lot of different places. And I would say too, sources like Marijuana Moment, they're great about giving out information on what's available for people to take part in.
Yeah, just let all the listeners, what we will do is we will send out this recording of the webinar, as well as we'll provide a link to the Realm of Caring website. So if you're interested in finding out more, definitely just click on the link, connect with someone at Realm of Caring or Sasha herself. I think that's really kind of, I've run the gamut of all my questions that I have, except for one. It was something that you mentioned at the very beginning, and I know when I first got into the industry that you mentioned Israel's been studying this for, I think it's been 30 plus years, and they have a lot of data. Do we have access in the US? I mean, do we have access to it? Are we using it, or is it still um, not really part of our studies and what we're doing?
I think that a lot of the people are using the published data that has come out of there. They're using it as a catalyst for studies to be performed here. So, I mean, even for example, they did a veteran study for PTSD in Israel, which we cited in the reasoning behind having a veteran study here in the United States, because there have been, documented benefits of individuals returning from, areas of war, or just, for just veterans in general, leaving service and then finding benefit from cannabinoid therapy. So it is out there. It's just, you got to comb through and find it a lot. And then another thing we do have on our website at Realm of Caring is we have a research library. So we source and we continually add. So you can search by condition, and we'll have global research in there too, not just what's come out of the United States.
We have another question, Sasha. What are your thoughts regarding or around regulatory pathway to more U.S. clinical research?
I think that we were almost, we're kind of there. We do have clinical research and clinical trials that are already taking place. I think that when it comes to what we were almost at with Schedule 3, that would have opened more potential, because what moving cannabis to a Schedule 3 would have done was it would have given us at least the acknowledgement that cannabis has medicinal benefit and that it should be researched further. And I believe that's where HHS was going with that recommendation. Of course, that has been, indefinitely postponed, but it's a step in the right direction, and it's showing that we are paying attention to it. And I think that with this NIH grant that has gone to Johns Hopkins, even though it's an observational study, it is out of recognition that everyday people are using cannabis for medical conditions. And if we understand more, what are the conditions that they're using for, how can we narrow in on those different conditions to have clinical studies for, specifically fibromyalgia, or, for autism, or, whatever those might be. So, yeah, it's there. There are the clinical trials that are taking place. And as we move more towards this acceptance of rescheduling cannabis, we'll get even further.
Yeah, then there's a follow-up question. Are there current federal bills that would benefit clinical research? The Farm Bill, which I haven't seen any movement on that.
Right. Yeah, it's a bit stalled right now. And so the Farm Bill would be for CBD. And so because it already has the federal legal status, we have a pharmaceutical based off Epidiolex, which is a CBD isolate. So as far as the clinical research for CBD, that can happen with the status of it now. As far as cannabis, the federal movement would have been the rescheduling to Schedule 3 to allow more research to take place. And so it's kind of just seeing what happens in this administration as far as that.
Yeah, and again, as my partner Jim Marty told me when I first got out, a lot of hard lefts and hard rights. There was a lot of positive movement on the rescheduling, which I was a little surprised by. There seems to be a core resistance to that. But again, we'll see how the chapters lay out within the cannabis industry. I don't think any of us can conclude on anything. One day we might wake up and it's back on, and they're going to have the hearings and so forth. So that would be a great resolution for a lot of the whole industry itself. Again, Sasha, thank you. Great conversation. I've really enjoyed the input and the research knowledge that you have, and hopefully listeners got something out of this. Again, we will provide a link in our website or in the email to everyone that signed up for the webinar, so they can gain access to the research that you do and additional information, or even contacting you. So again, thank you, and thanks everyone for joining, and have a good rest of the week.
Thank you. Thanks, Cory.